Hello.
Hi, my name is Crystal. I'm going to be the family nurse practitioner taking care of you today. We're going to pick up on our physical assessment, doing a thorax and lung examination.
Okay.
I'm performing hand hygiene for my safety as well as yours. So we are going to start by just looking at the patient, looking at anterior versus posterior diameter. Okay. And he is wider than he is in depth. That is correct. Looking for any pectus excavatum or pectus carinatum, none is present. I am going to ask you if you can please remove your shirt for me.
Okay.
Excellent. So again, no pectus excavatum or pectus carinatum. There are no surgical or trauma scars, no gynecomastia is present. Patient does not have barrel chest deformity and also does not have any wounds or lesions. Okay, I'm going to be looking at the patient as he breathes. I'm looking for any supraclavicular or intercostal retraction. There's no paradoxical movement of the abdomen as he breathes. No muscle wasting or hypertrophy present. All right, I'm also going to be looking for any abnormalities in size shape, any bruising, of which I see none present. Next, I'm going to be looking at the patient for any signs of respiratory difficulty, looking to see that he is not tachypnic. And I'm also looking for any cyanosis, any circummoral or of the extremities. I'm also listening for any audible wheezing or stridor, of which none is present. Next thing I'm going to do, I'm going to put my hands on your chest, and we're going to be testing for symmetrical chest expansion. Okay, so what I'd like you to do is take a nice deep breath in. Okay, one more time. Good. So there was symmetrical chest expansion. Next thing I'm going to be doing is I'm going to be palpating for tactile fremitus. Each time my hand touches you in a different location, I'd like you to say the word 99.
99. 99. 99. 99. 99. 99.
Excellent. And normal vibration was appreciated bilaterally. Next thing I'm going to be doing is I'm going to be percussing. That means I'm going to be tapping along the front of your chest. Okay, just be patient with me as I do this. And lungs are giving a healthy resonant and percussive note. There was no dullness noted. All right, next I'm going to be listening to your lungs, auscultating those anterior breath sounds.
Okay.
Okay, each time my stethoscope touches you, I'd like you to take in a nice, good, deep breath for me, okay?
Okay.
So I was hearing normal vesicular breath sounds, and that is correct for location. Next, I'm going to ask my patient to swing his legs to the other side of the table and reposition. Excellent. All right, swing those legs a little more in. Great, perfect. So we're going to start inspecting the posterior chest. Here we're going to be looking for any scoliosis or kyphosis, any surgical or traumatic scars, any bruising. I'm going to be looking for any deformities, and I do not see any present. We do look like we have symmetrical respiratory movement on both sides. All right, next we're going to be palpating for tactile fremitus. The same thing, when my hand touches you, I'd like you to say the word 99.
99. 99. 99. 99. 99. 99. 99. 99.
Perfect, and I felt normal vibration there. All right. We are going to move towards percussing the chest. Again, you're going to feel me tapping on your back. And that was appropriate. There was a nice resonance of the lungs. So next we're going to be percussing for diaphragmatic excursion. So for this, I'm going to ask you to take a deep breath in and hold it, and you will feel me palpating down your back, okay? Ready? Go ahead and take that deep breath in and hold. And let that out. Okay, perfect. And now I want you to take a breath in, a breath out, hold that exhale. And we are looking at around 5 centimeters. And that is healthy in a normal adult. Next, I'm going to be auscultating for egophony, bronchophony, and pectriloquy. So the first thing I'd like you to do is when you feel my stethoscope touch you, I'd like you to say the words 99.
Okay. 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Excellent. And that was a very muffled sound, and that is a correct finding for bronchophony. For whispered pectriloquy, I'd like you to say a sequence of words. I'm going to ask you to say 1, 2, 3 in a whisper. 1, 2, 3. Each time my stethoscope touches you.
Okay.
All right?
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Excellent. And so there I could hear the whispered sounds that were clear and distinct. I'm sorry. They were faint sounds, not clear and distinct. We're going to move on to egophony. All right. So here I'm going to be listening, and I'd like you to say the letter E, like in beat.
Okay. E, 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 E.
Excellent. And so there, if there was any consolidation, that would have changed to an A, but what I did here was, again, an E sound. So that was a normal test for egophony. Last, we're going to auscultate those posterior lungs. Each time you feel my stethoscope touch you, I'd like you to take a breath in and let it out. Okay. Excellent. And so those were normal vesicular breath sounds, and that is correct. Next, I'm going to ask my patient to go ahead and lie back. We're going to begin the cardiovascular examination. Oh no, my patient, let me get those pillows back for you.
Help me.
So for this examination, I do want him at about a 45-degree angle. And let's go ahead and add that behind your head. Are you comfortable there?
Yep.
Perfect.
Just wake me up when you're done.
All right. So we're going to be inspecting and locating the point of maximal impulse. This is going to be the location where the cardiac pulse can be best palpated. So we're going to be looking for the mid-clavicular line, and I'm going to be palpating down to that fifth intercostal space. And we are in the fifth intercostal space mid-clavicular line for that PMI. Next, we're going to be assessing JVP. So I am going to ask the patient to turn his head to his left. Okay, I'm going to be looking, seeing if I can visualize that IVJ. Okay, excellent. And from there, I'm going to be measuring the distance between that. I'm looking at about 4.5 to 5 there. All right. So that was measuring from the sternal angle to the top of the pulsation point of IVJ. I'm going to now assess the carotid pulses. Let's relax for me. Good. Other side. Very nice. All right, we have strong carotid. Next, we're going to be assessing the brachial artery. Okay, I'm going to come to the other side. Excellent. And we are going to continue with auscultation of the heart sounds. So you are going to feel my stethoscope touching at various points. Do not think that there's anything wrong. I'm just taking a listen to those heart sounds, okay?
Okay.
So we're on the aortic now. Moving over to pulmonic. Coming down to Earth's point. Tricuspid. And mitral. Very good. And lastly, I'm going to be palpating for any thrills or throughies. So just feel my hand on you. Alright. And I do not feel any thrills. There's no vibratory sensation. So that would be a negative test. Thank you very much for completing the thorax, chest examination, and cardiac examination. We'll pick back up in a few moments to complete our abdominal exam.
Okay.
Thank you very much.